So you're a therapist and your patient comes in and they just tell you that they're having thoughts of suicide. Do you know what to do next? This video series is about that. Quick summary. You're going to learn how to do an assessment. If you don't already know, you're going to learn. Hopefully you do know. And I encourage you to follow up study with this because you're going to want to know what to do in these situations. So you're going to determine what risk they are. We're going to talk about treatment plans. We're going to talk about if someone's high risk, 72-hour hold, how to do that, and the steps involved in that might differ from state to state. We're going to talk about long-term treatment, how to pivot and address the depression itself. We're going to talk about risk factors, things to look out for, conversations to have. For example, if you haven't talked with your patient about firearms and you're trying to do means constriction or a safety plan, you need to talk to them about that. Most suicides are by firearms. So you're going to want to talk to them about, okay, for a time you might not be able to trust yourself, and that's okay not to trust yourself. And we need to make sure that if you have a moment where the emotion takes over and you are not in control, that you don't have access. That's a conversation that you need to have. So this is just a preview about what we're going to talk about. You may be wondering, who am I to tell you about this? Well, over 20 years ago is when I started talking people out of suicide. I was a teenager, talking other teenagers out of suicide. I volunteered. I learned what to do in those situations. I learned to determine risk. I went from volunteering for a few years at one agency, then to another, and then training new volunteers, and then co-authoring their training manual. And I have also been a keynote speaker on suicide prevention. So, although I may not be the world's best expert, what I do know, I would like to share, and I would like other therapists to know what to do and not have any misconceived notions about what happens next. So, stick around for this video series or this playlist. I think you will find it informative and helpful, and hopefully it will make you more confident as a therapist.